Hello, I'm Dr. Emily Carter, a medical doctor focused on providing thoughtful, evidence based care and supporting patients in achieving better health outcomes. Your glutes are the most powerful muscles in your body. After 65, they're also the first ones to completely shut off. And when they go, your knees go, your hips go, your back goes, everything collapses from the middle. I've watched it happen thousands of times, not dramatically, quietly. A patient comes in complaining about their knee. We treat the knee. 6 months later, it's the hip, then the lower back, then a fall, then a fracture. And somewhere in that whole cascade, nobody stopped to ask the obvious question: why did this start in the first place? I started asking it about 15 years ago, and the answer, more often than I expected, was the same every time. The glutes had stopped working, not weakened, not tired, stopped. Functionally offline. The brain had essentially deprioritized the signal. The muscle had lost its ability to respond quickly, and the entire posterior chain, the system of muscles designed to keep you upright, mobile, and protected, was running on backup power, and the backup system always burns out eventually. Today, I'm going to give you 3 exercises that directly address this. Not 3 exercises that generally work your lower body. Not 3 movements that happen to involve your glutes somewhere in the chain. 3 exercises specifically chosen because they force glute activation in older adults, even in people whose glutes have been functionally quiet for years. But first, you need to understand what you're actually dealing with, because if you don't understand the problem, you'll do these exercises wrong and wonder why nothing changed. Why glutes shut down after 65? There's a clinical term for this: gluteal amnesia. It sounds almost polite for something so destructive. Here's what happens. Modern life, chairs, cars, couches, puts your hips in a flexed position for hours every day. When your hip flexors are chronically shortened, they create reciprocal inhibition on your glutes. Your nervous system, trying to be efficient, starts treating the glutes as unnecessary for the movement patterns you're repeating most. Over months and years, the neural drive to those muscles diminishes. The signal gets quieter. The muscle responds slower. Eventually, it barely responds at all. And here's the part that matters most for people over 65. This process accelerates dramatically with age. The neuromuscular connection, the speed and efficiency with which your brain communicates with your muscles, declines naturally after 60. In most muscle groups, this is manageable. In the glutes, because they were already being deprioritized, the decline is severe. Research from the Journal of Electromyography and Kinesiology found that adults over 65 showed significantly delayed glute activation timing compared to younger adults during basic walking and stair climbing tasks. Not weaker activation, delayed. The muscle fires late after the joint is already absorbed the load it was supposed to be protected from. That delay is why knees wear out. That delay is why hips fail. That delay is the half-second gap between your foot hitting an uneven surface and your body correcting. The gap that turns a stumble into a fall. You can close that gap. That's what these 3 exercises are designed to do. Exercise 1. Glute bridge with 5-second hold. Lie on your back, knees bent, feet flat on the floor about hip width apart, heels roughly 8 to 10 inches from your glutes, arms flat at your sides. Now, here's the part most people skip, and it's the most important part. Before you lift anything, squeeze your glutes hard. Hold that squeeze for 2 full seconds. Then, drive through your heels and lift your hips off the floor until your body forms a straight line from your knees to your shoulders. Hold the top position for 5 full seconds, squeeze the entire time. Then, lower slowly, 3 seconds down and repeat. The reason for the pre-squeeze is neurological. In people with gluteal amnesia, the brain defaults to using the hamstrings and lower back to perform this movement. The glutes get bypassed entirely. The pre-activation squeeze forces the nervous system to establish the connection before the movement begins. You're essentially reminding your brain, which muscles are supposed to be in charge. A study published in the Archives of Physical Medicine and Rehabilitation showed that glute bridge training with deliberate activation cues produced 43% greater glute muscle engagement in older adults. Compared to standard bridge performance, the cue makes that much difference. Do 10 repetitions, rest 60 seconds, 3 sets. Within 2 weeks of consistent practice, most people report feeling the glutes engaged during activities they never felt them in before. Standing up from a chair, climbing stairs, walking uphill, that's the neural pathway rebuilding. That's exactly what you want. On modification, if getting down to the floor is difficult, this exercise can be performed on a firm bed or low therapy table. The mechanics are identical. The results are identical. Exercise 2, standing wall glute press. Stand facing a wall about arm's length away. Place both hands lightly on the wall for balance. You're not leaning into it, just using it as a safety reference. Shift your weight onto your left foot. Keep a very slight bend in that standing knee. Never lock it straight. Now, lift your right leg behind you, keeping it straight, and press it back and slightly upward. We will continue with the rest of this exercise and more in the next part. Hold at the top for 3 seconds, squeezing the glute of the working leg as hard as you can. Return slowly, 10 repetitions each side. This is a hip extension exercise, and it isolates the gluteus maximus, the largest and most powerful portion of the glute complex, more directly than almost any other standing movement. The reason this matters specifically for seniors is the standing position. Most glute exercises are performed lying down, which is valuable, but it doesn't train the muscle in the context your body actually uses it. Upright, under load, balancing. The wall press bridges that gap. You're building strength in the position where you need it most. Research from the Physical Therapy Journal found that hip extension exercises in a standing position produced significantly greater functional carryover to daily activities in adults over 65 than floor-based exercises alone. The muscle learns to fire in context. Keep your upper body upright throughout. Don't lean forward as you press back. That's compensation, and it means your lower back is doing the work instead of your glute. If you find yourself leaning, reduce your range of motion until the strength catches up. Progress this over 3 to 4 weeks by adding a light resistance band just above the knees. The band increases gluteus medius engagement, the side portion of the glute that controls lateral stability, and is directly responsible for preventing the knee collapse pattern that leads to both knee and hip degeneration. Exercise 3. Step up with glute drive. You need a single step. A staircase works perfectly. If stairs aren't accessible, a sturdy 6 to 8 inch platform works as well. Stand at the bottom of the step. Place your right foot fully on the step. Whole foot, not just the toes. Now, here's the key. Before you push up, squeeze the glute of your right leg. Feel it engage. Then drive through that heel and not your toes, your heel, and step up, bringing your left knee up to hip height at the top. Pause for 2 seconds at the top. Hold the balance. Squeeze. Then step back down slowly, controlling the descent. 10 repetitions each side, 3 sets. This exercise does something the first 2 cannot. It trains your glute under a full body weight load in a single leg position, which is exactly the demand placed on it during every single step you take while walking. When you walk, you are briefly balancing your entire body weight on one leg with every stride. If the glute of that stance leg isn't firing correctly and quickly, the hip drops, the knee rotates inward, and the joint absorbs stress it was never designed to handle repeatedly, thousands of times a day. The step up with glute drive trains the muscle to handle that exact load in that exact position. Nothing transfers more directly. A study in gait and posture found that seniors who completed 8 weeks of step training showed measurable improvements in single-leg stance stability, walking speed, and stair climbing confidence, with the greatest gains in those who had shown the weakest baseline glute activation at the start. The people who needed it most responded the best. Start with a lower step if needed. There is no benefit to rushing the height. The neurological work, the reconnection between your brain and your glutes, happens at any height. What matters is the quality of the squeeze, the deliberateness of the heel drive, and the controlled descent. How to put this together? 3 exercises. That's it. You don't need more than this to start. Glute bridge, 10 reps, 3 sets, 5-second hold at top. Wall glute press, 10 reps each side, 3-second hold. Step up with glute drive, 10 reps each side, controlled descent. Do this every other day, not every day. Muscle tissue, especially in older adults, needs 48 hours to consolidate the adaptations from training. Daily repetition without recovery actually slows progress. In the first week, focus entirely on feeling the right muscles work. If you don't feel it in your glutes, stop, reset, and reactivate before continuing. The sensation of the muscle working is the feedback system. Trust it. By week 3, most people report a noticeable change, not just in the exercises themselves, but in how their body moves throughout the day. Stairs feel more controlled. Standing up from chairs feels easier. The lower back tension that seemed permanent starts to ease. That's not coincidence. That's the posterior chain coming back online. That's the body doing what it was always capable of doing once the right muscles were given the right signal. The glutes didn't disappear, they just went quiet. Your job now is to wake them back up. Start today, 1 set of each. That's all it takes to begin.